guys, welcome to my channel. This is Health Discourse Ask Your Doctor. This is Dr. Babalola, your host. Today we shall be discussing an interesting topic. We're discussing breast self-examination. You will agree with me that the prevalence of breast cancer is on the increase in our society, and the reason is not far-fetched. One of the reasons is the fact that many of our women don't regularly examine their breast. And the truth is, this does not cost a dime. This is something you can do on your own, in your room, while alone, without anyone being there. So I feel if it is as cheap and easy to come by as this, there shouldn't be any reason why any lady shouldn't participate or involved in this self-examination as it is required every month. In this video, you are going to learn the importance of breast self-examination, why you need to carry it out, is it really necessary or not, and how you are going to carry it out. I want you to pay attention from the beginning to the end of this video, as short as it's going to be filled with a lot of value and a lot of information as far as health care is concerned. Let's proceed. Breast is one of the two prominences located on the upper ventral region of the torso of primates. What this means is that breast is actually that prominence that is found at the upper part of the chest. It can be found in both male and female, but in female, it serves as mammary gland that helps in the production of milk, which is used in the feeding of the newborn. Both female and male develop breast from the same embryonic tissue. That is one of the most fantastic components of this information. Some of us might feel, oh, perhaps the origin of the breast in male is different from the origin of breast in female. No, the two develop from the same embryonic origin. In Nigeria, we have more than 100,000 cases of breast cancer being recorded every year. This burden is huge and the prevalence is quite enormous. Hence the reason for this kind of video that will help to circulate appropriate information and help prevention. Breast cancer is more common in female than male, just like a lot of us will be aware of. So what are the importance of monthly breast self-examination? Number one, it serves as a proactive step in determining any developing breast abnormality or breast lump. If you do not examine your breast monthly, as at when required, you wouldn't be able to know when there is any ongoing development that you can easily pick at early stage or not. The other importance of monthly breast self-examination is timely detection of any unwanted breast changes. In the course of this discussion, we are going to show you those things you should look out for. So those things you are meant to look out for are the signs and symptoms you are going to notice that will be signal to you in knowing if there is an abnormality or unwanted changes that are ongoing on the breast. The other importance of monthly breast self-examination is for regular reassurance for people with risks of breast cancer and women of reproductive age group. Certain people are nursing certain fear because they have had that family history. And as a result of this, there will be need for them to be reassured month in, month out by carrying out regular breast self-examination. What to do before breast examination? What you should note are this: it should be done during menses to get the best result and to be able to get the best changes that can be of medical significance. It should be carried out during your menstrual period to expose your chest and your trunk. You should stay in front of a mirror when you're about doing it. You should position a mirror before you when you're about doing it, or you lie flat on the flat surface while you'll be able to expose your chest and your trunk. And you should note that in examining the breast, one will be examined at a time. You are not going to examine the two at the same time. You are going to examine one side first before you examine the other and then compare the two. Examination is done with the hand on the side of the examined breast placed at the occiput. What it means is that when you are examining a particular breast, take for example the right breast, you should raise that particular right hand and put it at the back of your head. By so doing, you'll be able to use the left hand to move and examine the right breast while the right hand is placed at the back of your head while you are standing in front of a mirror. You examine the right breast with the left hand. So when you want to examine the right breast, the right hand must be placed at the back of your head while you use the left hand to examine the right breast. The same thing is applicable to the left breast. When you want to examine the left breast, the left hand should be placed at the back of your head and your right hand be used to examine the breast. Let's proceed. What to check out for? If I just asked you to proceed with breast examination without letting you know what to check out for, definitely you wouldn't be able to know what to check. There are three major things that you need to do while examining your breast. On each of them, the three things you need to do are: you look, which we call inspection; you feel, which we call touch; and you press, which is a component of touch. Each of these things that you are going to do, there are certain things you need to carry out while doing them. So let's start from the look aspect. What are those things you need to look out for? You need to look out for the shape of the breast on both sides, as well as the shape of the nipple, or any form of obvious differences. You want to see, is any of them sagging more than the other? Is any of them with any difference in shape? Is there any bulginess or any dimple anywhere? You want to check for the size of both sides. You can easily see it. That's why it is essential when you examine in front of a mirror. You have to look at the size. Is anyone bigger than the other? Normally, they are meant to be of the same size most of the time. Even though that during the menses, there will be that engorgement of the breast. But even at that, they are meant to be of almost the same size. You want to look out again for change in the skin color over the breast and over the nipple. You want to check for any change in the appearance or the texture of the breast skin. You check out for the shape. We want to check out for the size. We want to check out for change in the skin color of both the breast and the nipple. We want to check out for any form of change in the appearance or the texture of the skin, which will come in form of peeling, scaling, drying, or any form of dimple that is developing or depression that is developing on the breast surface. You now want to forge ahead to now feel. It is this feeling aspect that is also of importance. There's any segment that is not important, though, but this feeling aspect is important. I told you earlier on that when you want to examine, you do it during your menstrual period. You expose the upper part of your body, your chest most especially, and you do it in front of the mirror. So whilst in the front of the mirror, you check one part before the other. So if you want to check the right breast, you put your right hand at the back of your head and you use the left hand, that's the surface of the hand, and you now use it to feel the breast. So what you are going to do is that when you are looking at the mirror, you are going to use an imaginary line like a cross, which cut across the tip of the nipple, that cut across the breast and divide the breast into 4 quadrants. So when you divide the breast into 4 quadrants, while your hand is behind your head, while you raise your head a little bit, looking at the mirror, what you're going to do is to examine and feel each part of the quadrant from the top to the bottom. From the top side, you feel the top right and move to the top left. From the top left, you move to the bottom left. From the bottom left, you move to the bottom right. So you feel it. What are those things you want to check out for when you are feeling and you are checking each of these quadrants? What you want to check out for is there any form of swelling or any form of mass or lump that is within the breast tissue? You'll be able to feel it because it's at this time of menstrual period. The breast is expected to be succulent, so that at this time you'll be able to detect any form of ongoing or any form of developing lump or mass within the breast tissue. So that is the reason why it is very, very reversible that it is carried out during the menstrual period. Like I said, when you want to feel it, you stay in front of the mirror, your upper part, which is your chest, exposed properly, and you raise your right hand. If you want to check the right breast, you raise your right hand, put it behind your head, you look at the mirror and use an imaginary line to divide the breast into 4 quadrants, cutting across the nipple. So having divided it into 4 quadrants, you now start from the top right quadrant. You feel gently, rub gently. You move to the top left quadrant. You feel gently, you feel from the surface, and you press down and feel if there's any developing lump or mass within the breast tissue. You move to the bottom left, you feel it as well, and move to the bottom right, you feel it as well. Repeat the same thing for the left breast. So what you do also is to raise your left hand and put it behind your head, while you use the right hand this time around to now feel the breast. We call it palpation. So what you do is that you also use the same imaginary line to divide the breast into 4 quadrants. The next thing you want to do is to press. So when you place your hand at the back of your head, you now want to press. You press from the inside out to see if there's going to be any breast milk that's going to be expressed from the nipple. If there's going to be any form of discharge that's going to come out, it should be a clean discharge, not discolored discharge, not brown or reddish. It should be a clean one if there's going to be any one at all. So you want to check out for any form of discharge that's going to come out, and if there's going to be any discharge, it should not be a discolored discharge at all. And also, you also want to feel if there's going to be any pain sensation that's going to be triggered by you pressing the breast at this stage. So this is the way you are going to examine your breast. So talking about the examination, this is the pictorial outlook of the examination I just described. When you look at the first picture, an individual staying in front of the mirror, and then raising the hand, which is the hand that you are going to use to examine, and look at the top, look at the next picture that shows how you are going to use the imaginary line to divide the breast, and look at the 5th, the 6th picture, and the 7th picture. Look in the mirror for visual lump, pattern, skin texture, and change in the nipple shape and abnormal discharge. So these are the things you want to check out for. Having done this, if everything is intact and safe, definitely you are sure that everything is fine for this particular month. All you need to do is to get prepared for next month as well. So having listened to this and having been told the importance of carrying out self-breast examination, I am definitely sure that you have learned a lot, and then you proceed to do the same whenever you're having your next menstrual period, in order to be able to know your status and to be reassured that everything is fine as far as your breast care is concerned. Thank you very much. Like I stated earlier on, if you are yet to subscribe to this channel, kindly do so right away. Feel free to share the video with your loved ones and for someone that you know is going to be of benefit to. Let me get your feedback through the comment section. Also like the video as well. I so much appreciate that. Thank you very much. See you in the next video. Bye for now.